Our next topic is about diagnostic and decision making system. So, AI enabled diagnostics and clinical decision support system, examining how these technologies are reshaping the interpretation of clinical data across multiple medical subspecialties. So we begin by tracing the underlying computational approaches such as machine learning, deep learning, natural language processing, and multimodal data fusion that allow digital tools to analyze symptoms, imaging, laboratory results, and patient histories. Emphasis is placed on how this system generates inferences, identify patterns, and support diagnostic reasoning, as well as how they integrate into existing clinical workflow without disrupting the clinician's decision-making authority. So from this technical foundation, the narrative shift towards the real-world clinical application of diagnostic AI. Examples spans from biology, pathology, dermatology, cardiology, and primary care triage, illustrating how AI tools can augment clinician expertise, reduce diagnostic delay, and improve consistency in interpretation alongside these opportunities. This lecture examines the regulatory, ethical, and operational considerations that shape the development and deployment of such systems. This includes the framework that governs safety, accountability, governance, algorithmic transparency, and post-deployment monitoring. Elements that are essential for ensuring that AI tools performs reliably across diverse population and clinical environment. So here you'll learn by gaining a comprehensive understanding only not only how diagnostic AI system function, but also of critical evaluation method used to assess their reliability, safety, and ethical implication. This includes approaches for validating model performance, detecting bias, ensuring clinical relevance, and maintaining trust among clinicians and patients. So these are my contents. These are my objectives. And AI-enabled diagnostic have moved far beyond their early experimental phase and now permeate nearly all major areas of clinical medicine. This widespread adoption reflects a broader transformation in healthcare, where computational tools are increasingly embedded in routine diagnostic reasoning, data interpretation, and clinical decision making. What began as a target application in a few technologically receptive fields has grown into a cross-specialty ecosystem of AI-driven support. Radiology and pathology naturally emerged as the earliest adopter because of their workflow rely heavily on high volume, high resolution image, a data type that aligns well with the strength of deep learning. This specialty provides fertile ground for early breakthrough is in image classification, segmentation, and pattern recognition, demonstrating that AI could match or exceed human performance in specific well-defined tasks. As confidence and capability grew, other specialties rapidly follow. Oncology, this now uses AI for tumor detection, genomic interpretation, and treatment stratification. Dermatology benefits from image-based lesion analysis and risk scoring. Cardiology integrates AI into ECG interpretation, echocardiograph, and risk prediction model. Neurology applies AI to stroke detection, seizure prediction, and neuroimaging analysis. Genetic leverages AI to interpret complex variant data and support precision medicine workflows. So each specialty interacts with AI in ways shaped by its modalities, clinical routines, and diagnostic complexity. For example, dermatology relies on surface level image, while cardiology blends imaging with waveform data and longitudinal risk model. Pathology deals with gigapixel slides, whereas genetic works with high dimension sequence data. This difference influences not only how AI systems are designed, but also how they are validated, deployed, and monitored in practice. So, to understand this variation is essential for evaluating diagnostic AI responsibly. A system that performs well in one of specialty may fail in another if data structure, workflow integration, or clinical decision pathway differ. Specialty specific context determines what good performance looks like, how errors manifest, and who they affect. What level of interpretability clinician requires, how AI outputs into existing diagnostics processes. What regulatory or ethical concerns are most salient? Recognizing these nuances allows clinicians, developers, and policymakers to assess whether AI tool is truly suitable for a given diagnostic environment, rather than assuming that success in one domain automatically translate to another. So, clinical decision support systems, CDSS, are designed to enhance clinicians' judgment by analyzing patient information and generating structured recommendation for diagnosis, management, or further investigation. At their core, this system aims to reduce cognitive burden, improve consistency, and support evidence based practice by offering timely insight drawn from large volume of clinical data. Traditional CDSS relied on rule-based logic, where expert encoded clinical guidelines, decision trees, and if-then statements into software. These systems were transparent and predictable, but they struggle with ambiguity, complex presentation, and variability inherent in real-world clinical data. Their performance was limited by completeness and accuracy of the rules provided. Contemporary AI-driven system represents a major evolution. Instead of depending solely on predefined logic, they learn patterns directly from data, including imaging, laboratory values, electronic health records, and even free text clinical notes. Machine learning and deep learning models can detect subtle relationships that may be difficult for humans to articulate explicitly, allowing them to support tasks such as risk prevention, anomaly detection, triage, and differential diagnosis. So this system adapts to complexity in ways that rules-based systems cannot, making them powerful tools in high volume or high variability diagnostic settings. However, technical sophistication alone does not guarantee clinical usefulness. Effective decision support requires seamless integration into clinical workflow, meaning the system must deliver, recommend at the right moment, in the right format, and without disrupting the clinician's routine. A tool that is technically accurate but poorly integrated will be ignored or misused. Equally important is transparency. Clinicians must understand enough about how a system arrives at its recommendation to judge when to trust it and when to override it. This does not require full algorithmic interpretability, but it does require clarity about data sources. Model limitation, model limitation and condition under which outputs are reliable. Without this transparency, trust erodes and system risk becoming either over relied upon, or entirely dismissed. In some, clinical decision support system blend computational power with clinical reasoning, but their success depends on thoughtful design, workflow alignment, and a level of explainability that supports informed, accountable clinical judgment. So, neural networks have fundamentally transformed molecular imaging by automating the detection of subtle features within complex imaging data, unlike traditional image analysis methods, which rely on handcraft features defined by human expert. Neural networks learn directly from large datasets. This allows them to identify molecular signature, spatial pattern, and quantitative biomarkers that may be too faint, too high dimensional, or too complex for human interpretation alone. In practice, this system can detect early disease processes such as metabolic changes, receptor expression patterns, or microstructural alteration, long before they manifest as visible abnormalities by quantifying image biomarkers with high precision neural networks support earlier diagnosis, more accurate disease staging, and improved monitoring of treatment response. So their ability to integrate multiple imaging channels or modalities like the PET, MRI, CT, fluorescence imaging, fluorescence imaging further enhances their diagnostic power, enabling a richer and more nuanced understanding of underlying biological processes. So the performance of these models depends on several critical factors. Number one, quality and diversity of training data. Number two, strength and model architecture. Number three, the rigor of validation and testing. Okay. Precision oncology use artificial intelligence to make sense of enormous volume and complexity of data generated in modern cancer care. Tumors are biologically diverse, evolving in type entities, and understanding them require integrating genomic profiles, imaging, finding pathology data, and clinical history. AI system excels in environment because they can detect relationship and patterns across these model datasets that would be difficult or impossible for humans to identify consistently. So within this framework, AI supports a more detailed and biological grounded characterization of cancer. Machine learning models classify tumor subtypes with increasing granularity, distinguishing molecular signature that guides prognosis and treatment selection. Deep learning system identify actionable mutation from genomic data, flagging therapeutic targets or resistant mechanism that may influence clinical decision. Other models generate prediction about treatment response, estimating which patients are likely to benefit from immunotherapy, targeted therapy, radiation, or combined regimens, and these capabilities enable clinicians to tailor therapy to the individual patient rather than relying solely on broad population level guidelines. AI also enhanced risk stratification, helping clinicians determine which patients require aggressive intervention and which may be safely managed with less intensive approaches. So this refinement supports more personalized care, reduce unnecessary toxicity, and improves the alignment between treatment, intensity, and disease biology. However, the stakes nature of oncology means that no AI system can be adopted without stringent validation cancer treatment decisions carry profound consequences and errors in classification. Mutation detection or response prediction can directly affect survival outcome. For this reason, AI in oncology must demonstrate reliability, accuracy, generalizability, clinical relevance. So validation requires rigorous testing external datasets, prospective evaluation, and continuous monitoring after deployment. Only when these conditions are met can AI system be responsibly integrated into patient care pathway. So in essence, precision oncology showcases both the promise and the responsibility of diagnostic AI, the potential transform cancer care through deeper biological insight, and the obligation to ensure that every model used in clinical practice is safe, trustworthy, and aligned with the realities of oncology decision making. Computational pathology integrates with whole slide imaging with advanced AI-based tissue analysis, creating a digital environment which pathology slides can be examined, quantified, and interpreted with far greater precision and reproducibility than traditional microscopy alone. By converting glass slide into high resolution digital image, WSI enables algorithm to analyze tissue at multiple scales, from cellular morphology to architectural pattern, without the constraint of manual visual inspection. So AI system, this domain excels at identifying subtle morphological features that may be overlooked or inconsistently interpreted by human observers. They can quantify cells, measure nuclear atypia, detect mitotic figures, map tumor boundaries, and characterize microenvironmental structure with remarkable consistency. So this quantitative capability enhances diagnostic accuracy and reduce inter-observer variability, supporting more standardized and reproducible assessment across case institution and pathologies. Digital workflow further extend the reach of pathology services. Remote consultation becomes feasible and slides can be shared instant across geographic boundaries, enabling access to subspecialty expertise that may not be available locally, streamlined review processes such as automated pre-screening, prioritize case triage, and integrating reporting, improve efficiency, and reduce turnaround time. Excuse me. So these capabilities are particularly valuable in settings with workforce shortages or high diagnostic volumes. However, the reliability and clinical value of computational pathology depends on several foundational elements. High quality imaging, robust algorithmic performances, standardized reporting workflow integration. Together, this element determines whether computational pathology can deliver on its promise. More precise diagnosis, greater reproducibility, expanded access to expertise, and a more efficiency data-driven pathology workflow. Next is diagnostic medicine increasingly relies on ability to bring together vast and diverse form of clinical data, imaging, genomic sequences, laboratory values, physiological measurement, and electronic health records into unified analytical environment. So this convergence is made possible through advanced informatics systems that integrate data across platforms, formats, and clinical domains by enabling this different data to be processed. Collectively, informatics creates the condition for more precise, context rich, and comprehensive diagnostic reasoning. So, we explore how these systems function, beginning with the technical processes that allows heterogeneous data to be harmonized and analyzed at scale. It examines how imaging data can be linked with genomic markers, how laboratory results can be contextualized with clinical history, and how predictive models draw on this combined dataset to generate diagnostic insight. This integrated approach reflects a shift from isolated data interpretation towards a more holistic understanding of patient health. A key emphasis is placed on the infrastructure required to support such large-scale data integration. Effective mass data analysis depends on how strong data governance framework that ensure accuracy, consistency, and accountability. Interoperability across platforms is essential so they can move seamlessly between systems without loss of meaning or fidelity. Equally important are robust privacy and security standards that will protect sensitive patient information while still enabling meaningful clinical use. So when these conditions are met, integrated diagnostic system becomes more powerful tools for both individual and population level health. Some strengths, limitations, significant strengths to modern healthcare by enabling rapid analysis, complex data set, delivering consistent performance across repeated cases, and scaling efficiently across different clinical environments. So these capabilities make algorithmic tools powerful allies in diagnostic practice, especially in settings where clinicians face a high workloads of time pressure or large volume of imaging and laboratory data. When used appropriately, AI can enhance accuracy, reduce delay, and support home-informed clinical decision making. However, these advantages must be balanced against important limitations. Diagnostic AI systems are only as reliable as the data they are trained. Poor quality, incomplete, or unrepresentative datasets can lead to inaccurate prediction or biases outputs. Even well-designed models may struggle to generalize across diverse patient populations. New clinical settings or evolving disease patterns. Clinical environments are highly variable and AI systems may fail when confronted with conditions that differ from their on training context. This limitation introduces a range of risks. Algorithmic bias can lead to unequal performance across demographic groups, potentially reinforcing existing health disparities. Privacy breaches and cybersecurity vulnerability pose threats to sensitive patient information, especially as diagnostic systems become more interconnected. And there is also the danger of automation bias, where clinicians place too much trust in algorithmic output and fail to question or verify recommendation. And because of this risk, critical evaluation is essential. Diagnostic AI must be assessed not only for accuracy but for fairness, transparency, robustness, and clinical relevance. Safeguards such as strong governance framework, clear accountability structures, and rigorous validation processes are necessary to ensure that AI tools support, not undermine, clinical standards and patient trust. When implemented thoughtfully, Diagnostic AI can strengthen healthcare delivery, but its benefit can only be realized when its limitations are acknowledged, its risks are managed, and its use is guided by ethical, technical, and clinical oversight. Any questions? None? Okay, thank you.